Hi everybody, and welcome to today's In-Service, Recognizing Skin Conditions and Changes. My name is Cynthia Mitchell. I'm the Home Care Supervising Nurse for the Glens Falls office. A little bit of housekeeping before we begin. Attached to this video will be two links. The first link is the learning packet. You'll need to download or print that out to do along with this in-service to refer back to. The second link is to the quiz. After you've watched the video, you've reviewed the learning packet, you've taken the opportunity to ask any questions that you have, then you would take the quiz that is also linked to this video. If you have any questions, of course, there is a nurse during business hours here at the office. You can come anytime to ask questions. And if you're having any issues with the online test, you can come in and take it in paper form. Okay, so let's go ahead and begin. We're talking about skin conditions and changes. Skin is so important. It is the largest organ in the body, and it is referred to as the first defense. It is the first defense against infections, and it also alerts our body to danger, things like pain, change in temperature. And changes in skin condition can indicate many things. It can indicate pressure that's gone unnoticed, infections, the possibility of a blood clot, worsening disease processes. So it is very important to keep an eye on your client's skin each time that you are there, and also report any issues or problems. So let's delve a little deeper into the issue of skin. First question, who's at risk? People at risk for skin issues are those who don't move as much, those who have decreased mobility, perhaps they do not ambulate, are bedbound, or even if they are up and around, they are not as mobile as they once were. Those who are dehydrated or at risk for dehydration, those who are cognitively impaired, unable to process that they may be having an issue, or unable to process the steps necessary to prevent an issue. Those with circulatory issues, diabetes, heart disease, they are at greater risk of skin issues than those who do not have that. People who are incontinent, and we are going to review that in much more depth later on. Those who are dependent for nutrition, in other words, they are unable to feed themselves or unable to choose on their own their food, so they may be less likely to eat as well. Those who are obese, those with dry skin, older individuals, and of course our end-of-life clients. So let's first talk about aging skin. As the skin ages, the cells of the skin become thinner and flatter. They are unable to retain and hold moisture. That moisture balance helps provide a barrier to protect the inside of your body and the inner layers of skin. However, the cells, as they age, they kind of flatten out. They are unable to do their job quite as well. And the first issue we commonly see with our older individuals is very dry skin. Some things that you might notice with dry skin, people are complaining that it's tight, it's itchy, it flakes, it cracks. Sometimes it cracks enough that it bleeds, and that, of course, can cause infection. So what are some things that we can do to help people with dry skin? Helping them to stay hydrated. Drinking appropriately, having enough fluids also helps to hydrate their skin. Being careful with the cleansers that we use, of course, keeping them clean and dry, but we want the cleansers to be pH balanced, and we don't want any fragrance. Fragrances, even those that may be quote-unquote natural, do have natural compounds and chemicals, and those, of course, that are man-made chemicals can cause issues to our skin. So we want fragrance-free. You also, of course, want to check your care plan, but ideally you want to moisturize that skin, again, fragrance-free, after bathing the person. And you always want to make sure that you're patting and not rubbing, because, of course, as we all know, their skin is much more fragile. So patting to dry it, and then making sure we moisturize after. This is also a great opportunity to look over their skin. Do you notice a change in the color, a change in the temperature, patches of skin that are different than the rest? All of those things, it's important to report to your nurse if this is a change. If you are new to the case and you are not sure, and even if you aren't new to the case, if something does not look right, like the things I mentioned, reporting that to your nurse is so important, because your nurse has documentation of the other things that staff may have reported to see that there may be an issue happening. Another big common concern with skin is pressure ulcers, especially in our older individuals. As we age, often people have decreased circulation. That can cause a decrease in sensation. They don't have a strong reaction to pain, to a change in temperature, to simply to touch. They may not be aware that there's an issue. For instance, this is a very common one, particularly people that have circulatory issues or diabetes. They have decreased sensation, particularly in their feet. So they may not know, for instance, they get a new pair of shoes. The shoes don't quite fit right, and there's an area of pressure in there. They are unable to feel it. That's a very common one. So always checking out their feet is very important when you're bathing the person and checking their skin overall. Some other issues with regard to pressure ulcers in the elderly is they don't have as much adipose tissue or fat as those who are younger, and they get what's called the bony prominences. So for instance, their coccyx, the back of their shoulders, they don't have that adipose tissue there to kind of cushion. And as they lose that and they lean on it or sit on it, there can be more pressure there. That has them at an increased risk for a pressure ulcer. In addition, of course, what we all are aware of are people who have decreased mobility. Very common reason why they get aid services to begin with is that they have decreased mobility. And those people, of course, are at a much greater risk of pressure ulcers. Pressure ulcers can begin in 3 hours. Basically, what happens with a pressure ulcer is you have an area that, because of the pressure put upon it from an outside force, for instance, it's being sat upon, keeps the circulation from getting to that area. When the circulation can't get there, the oxygen and the nutrients cannot get to the skin cells. And when a cell does not have oxygen and nutrients, it dies. Okay, so what happens is the cells are not getting what they need to function. They can't sustain themselves. They die. That can cause a pressure ulcer. The skin in that area is no longer alive. And that is what causes a pressure ulcer. So not having circulation to that area for longer than 2 hours is all it takes to start a pressure ulcer. So let's talk about the areas, the bony prominences that are most at risk. And I'm going to discuss bed-bound patients, even though obviously with wheelchair-bound patients or chair-bound patients, that's also a big issue. So let's talk about the main areas. The first area, one that is commonly overlooked, is the back of the head. If your person is bed-bound, then they most likely aren't able to lift their head, turn their head well. Leaving the head in one position right in the middle of the back of the head is a bony prominence. There's no adipose tissue there to help cushion that area. Very important to turn the head, take some pressure off of that area. The shoulder blades, another very common one that often gets overlooked. Those shoulder blades, the edges of them, they stick out, and again, there's no adipose tissue there. Important to be moving the arms when you're turning and positioning your client to make sure there's not pressure on the shoulder blades. Of course, the common ones that most people are aware of is the coccyx and the buttocks. The coccyx in particular, which is right at the bottom of the spine, it's kind of a perfect storm for a pressure ulcer. If a person is semi-sitting up, the pressure is on the coccyx. In addition, if you look at the way our spine is shaped, it actually comes outward just a tiny bit at the bottom. And as we've discussed, our elderly people, our immobile people tend to have less adipose tissue or fat, particularly in that area. So you have that coccyx bone right underneath that skin. It's a perfect spot for a pressure ulcer, and it's a very common one. The heels, that's another very common one for our bed-bound clients. We want to make sure their heels are up off the bed. Keep in mind when we are getting their heels off the bed, if I have seen people take a blanket and roll it up really tight and stick it just above the heels, all you're doing is changing the pressure from the heels to just above the heels. What we want to do is use something like a pillow, and you want to distribute the weight evenly. So right about underneath the knee, all the way down to just before the heel. That distributes the weight of the legs evenly on both sides, all along the lower leg, to keep a pressure point from happening. In addition, when you're turning and positioning your client, you want pillows between the legs. You want pillows between the heels. There's no extra tissue there. If you don't have something between the sides of the heels or the ankle bones, you will get pressure ulcers there as well. So pillows are very important in turning and positioning our bed-bound clients. Another one that sometimes is overlooked is the top of the toes. You can have people, if they're unable to turn and position themselves, I have seen people want to, kind of tuck them in and tuck that blanket really tight around the bottom of the mattress. But what can actually happen is it can actually cause pressure along the top of the toes. The person either can't feel it or is unable to verbalize to you that there is pressure along there, and you can actually get pressure sores in that area. So it's very important, particularly with your bed-bound clients, that when you're done positioning them, you lift the end of the blanket, create a pocket there, so there's no pressure for the toes, so you don't have any pressure ulcers there. So let's talk about signs and symptoms, what you're looking for with a pressure ulcer. Some common things you see are reddened areas that when the pressure is taken off, they don't go back to normal. Okay, so you have an area, you usually see this a lot with a coccyx, it just stays red. Okay, it doesn't go back to the normal color. It may be warm to touch. Sometimes it blisters. Commonly after that, you have a reddened area. It may open, which is, an open ulcered area. Of course, any of those issues, you want to contact your nurse right away and report that, so that we can come up with a plan of care, a plan of action for them to prevent further issue and to heal what's already happened. So let's talk about prevention. As we've already been discussing, for pressure ulcers, turn in position at least every 2 hours, especially if your person cannot move themselves at all. 2 hours is the max. You really want to make sure you're turning and positioning. For our chair-bound patients, people that are up, but they're not up and walking around very often, even something as simple as a small, soft pillow to place under one side, so under one hip for an hour, straight on the buttocks, under the other hip for an hour. Very important. If your person is chair bound and they are having issues with any pressure ulcers on their coccyx, we may encourage them to lay down more times a day to get pressure off of that area and heal it. In particular, as we've already discussed, an area of concern is for people who are incontinent. They are obviously at much greater risk of breakdown, rashes. I mean, especially if they're incontinent, you think about it, the peri area is warm, it's wet, it's dark, you have ammonia from the urine, which changes the pH of the skin, negatively changes it. It actually increases the pH, which is not healthy. Bacteria feed on that ammonia, so they are at a much greater risk for infections, fungal infections, open areas, rashes. So what are the things that we need to do to prevent that? Hygiene, great peri-care. The moment that we notice that someone is incontinent, it is very important not only to change the incontinence product like the Depends, but to cleanse the area. Got to make sure we get that ammonia off, otherwise the pH is still not right and the bacteria can just, it's a breeding ground. So we want to make sure that we cleanse it really well. Again, no rubbing. That skin is extremely fragile, so we want to make sure that we gently wash it. Patting is better. Check your care plan. Usually we recommend a barrier cream. What the barrier cream does, of course, is it creates a waterproof barrier so that the urine doesn't come back and be exposed, the skin be exposed to that urine and the ammonia, etc., or the feces. A caveat with barrier cream, you want to do a nice thin film, like slapping it on, smothering them in it often doesn't help. And so just a nice thin even film to protect the skin. And when you're washing it, especially if it is a medicated cream, you want to talk to your nurse about that. Scrubbing it all off each time, which is kind of what we feel like we should do, sometimes is not helpful. The skin is just too tender there. So washing it, making sure that the ammonia is off of there gently, and applying some more is really the way to go. Barrier cream often has a high amount of zinc in it, which the body needs, the skin needs to regenerate itself and keep it healthy. Okay. So again, turn to position. 2 hours tops, very important. If your person is incontinent, excellent peri-care, as we all know, and I know we're all doing this to prevent breakdown and any issues. Checking over your client's skin every time that you're bathing them and assisting them, and reporting any issues, questions, problems, something just doesn't seem right. Those are all very, very important for you to do to contribute to the health and welfare of your client and their skin. I hope you all enjoyed today's in-service. Thank you very much for being with me, and thank you for all that you do for our clients to improve their lives every day. Have a great day.